Assalamu alaikum wa rahmatullahi wa barakatuh. And today we have an interview with Dr. Omar, a well-renowned specialist pediatrician practicing out of Compton Hospital. Dr. Omar is going to help answer some of our concerns and allay some of the fears we have as parents in these trying times.
Wa alaikum salam wa rahmatullahi wa barakatuh. Brother Shahid, Jazakallah khair for having me on your show. Inshallah, I will do my best to help answer your questions and clear up any doubts that our listeners might have on coronavirus and COVID-19.
Alhamdulillah, Jazakallah. Dr. Omar, we have a few questions that this virus out there, we have parents that have a lot of fear with regards to sending children back to school. We have a set of questions that have come from parents via emails, and we're going to ask you them. So Dr. Omar, in June 2020, we asked you if it was safe to send kids back to school. The Pediatric Association was firm on the fact that kids are not spreaders of this virus. Since then, we have had a resurgence in the form of a second wave and a mutated strain. With social media out there, parents have heard that this strain affects younger people and is more infectious and has higher viral loads. We have parents who are extremely scared to send their kids back to on-site classes because they have elderly parents and grandparents residing with them. Has anything changed from the last time we've spoken?
Bismillah ar-Rahman ar-Rahim. I begin by praising Almighty Allah and ask Allah to bless each and every one of us and to protect all of us during these very challenging and trying times. It's a very good question, and there's a few aspects to that question that needs to be answered. So I'll begin by saying that this coronavirus that we have had from last year has mutated, or in simple words, has changed its structure a little bit. In fact, they have come out with the term the South Africa variant or the South African variant, much like how Donald Trump once called it the China virus. They're now calling it the South African variant. Basically, what it means is that the outer structure of the coronavirus has changed its form a little bit. And in science, we refer to that as a mutation. What that means is that this virus has now changed its structure. So what implications does that have for us? What it has done in effect is that it's made this virus more infectious than it was last year when we first got to know coronavirus. So it's definitely more infectious, and the studies have shown it can be anything between 50% up to 70% more infectious. So your risks of getting infected is much more higher than it was last year. That's the first thing. The second thing that the mutation has shown, or the change in this coronavirus, is that, and although the studies are still evolving on it, which means they're still doing studies, but from the recent studies that have just come out, there is some evidence to show that it is a little bit more aggressive in the people that it does infect compared to last year. And in fact, from my own experience, what I've seen in people, and even in my discussions with nursing staff, what they've said is from their own experience, they see that the patients that they are presenting this year with coronavirus and that presented towards the end of last year with the new strain definitely appear more sick than they were. So yes, there is definitely some concerns about this mutation, and obviously we have to be careful, the same measures that we adopted last year. The second part of your question was, has anything changed with regards to children and whether they should be going back to school? Absolutely not. We strongly encourage that children must go back to school. That hasn't changed at all, and there's lots and lots of reasons as to why they should go back to school. I think the most important thing to know is that children are not super spreaders of this virus. That's the first thing. The second thing is, and we praise Almighty Allah for that, that this disease is not really a disease of children. You know, it has spared by far and large the pediatric population, not only here at home, but around the world. So it is extremely important for children to go back to school, and there's a lot of reasons for that, which we will discuss a little later on. But for now, I think it's very important that the message goes out to all the parents out there that it is extremely safe for your children to go back to school, and it is highly recommended that you do send your kids back to school. Was there any other part of the question that I haven't answered?
Yeah, the one part of the question is that it's affecting younger adults.
Yes. So I haven't come across any particular studies that have looked into that, but this is also anecdotal, meaning it's from my own experience, my own observations, my own discussions with other doctors and nurses. We're definitely seeing younger people getting infected, getting admitted to hospitals with the new strain of the coronavirus, which means probably last year you were seeing 60-year-olds or 70-year-olds or 80-year-olds getting admitted. But this time around with the new strain, we're seeing younger people, meaning people in their 30s, 40s, 50s, which we still consider to be quite young. So that's the type of age group that's now being affected and getting admitted to hospital. But alhamdulillah, it still hasn't had that kind of an impact on our pediatric population and on our children.
What about our 14, 15, 16, 17-year-olds that are your matric students?
No, the same applies to them. They're still relatively spared from it.
Alhamdulillah. The second question that we had was that the COVID team at Falaah College and the senior management was in consultation with Prof. Musa from infectious disease at UKZN this past weekend. And Prof did mention that we are seeing the number of cases declining daily. Does this mean that the second wave is over?
Yeah, I think the infectious disease specialist would be the best to answer that question. But my take on it is the numbers are definitely decreasing from what we were seeing last month to the number of cases that we're seeing now. And that's easy to follow if you follow these data. You get the daily cases. So there's definitely a downward trend in terms of the numbers. But that doesn't mean that we should, just start becoming more relaxed about the measures that we had implemented. I don't think it's the end of the second wave, but I would say that the peak of the second wave is probably over, and we've now turned the curve or turned the corner around the peak. There are still a lot of people getting infected every day, and every single infected person is a cause for concern. So we shouldn't let our guard down as yet. It's not too soon to say that it's the end of the second wave, but we've definitely passed the peak. Looking at also the number of admissions, the demand for beds in hospitals, there's definitely been a slight decline compared to the peak, especially in December 2020 when people were waiting in their cars, for beds. That situation has definitely been relieved to a certain extent.
If kids have comorbidities, example, diabetes, asthma, is there a risk for them coming back to school?
Yeah, so this topic has been looked at quite a bit from the start of the pandemic, and as pediatricians, our recommendations have been the same, irrespective of whether you have COVID or you don't have COVID, or whether we are living during these times of the pandemic or not, is all chronic diseases need to be controlled, need to be well managed. So if you're asthmatic, it's very important that your asthma is well controlled with medication. If you are diabetic, the same thing applies. If you have, for example, pediatric rheumatoid arthritis and you're on steroid therapy or nephrotic syndrome, kidney diseases, whatever chronic condition you might have, even if it's leukemia, which is a common, pediatric malignancy, and those people obviously have weakened or depressed immune systems, it's very important to manage all these conditions well, whether there's COVID or there's no COVID. But it's important to know that if our kids are asthmatic or diabetic, it is safe for them to go back to school, even under these current circumstances. Even if there is still a significant infection rate going on, it is very safe for them to go back to school as long as their chronic conditions are well controlled.
Dr. Omar, if parents are waiting for the vaccine before sending their kids back to school, when will this be?
Okay, for all the listeners in South Africa, I think it's important to know that in South Africa, even the adults or the frontline workers are waiting for the vaccine, and from what I believe, we'll be waiting for quite a while. The vaccines are supposed to be on their way, but they haven't arrived on our shores as yet, and nobody knows when they're going to arrive. So that is going to take some time. And then obviously it's the logistics with the distribution, who gets the vaccines, how soon they're going to get the vaccines. And then we must remember you need at least 2 doses and a little bit of time after you get the second dose before you can safely say that you have enough level of protection from this COVID virus. With regards to children, what we need to know is that children haven't been used in the trials as yet. They haven't given children the vaccine as yet, so we don't have any or enough data to establish the safety of these vaccines in children. We don't have enough data to establish how effective these vaccines are on children. So that means it's going to take even longer. So with regards to the adults here at home, although there's safety trials done, efficacy trials done, it's already been distributed in many parts of the world, we still are sitting and waiting for those vaccines. By the time we wait for the kids to get to get their trials done and to get enough data for us to say it's safe to give them, how much to give them, how much of the dose they must get, how many doses, I think that's going to take a very, very long time. So in view of that, there's no reason to wait and hold back our children purely because we're waiting for a vaccine to come out.
At Falaah College, our non-pharmaceutical approach of compulsory masking, social distancing, sanitizing points outside each classroom, temperature checks, cross-ventilation and strict no aircon policy is still our frontline approach. Is there anything you think we should add to strengthen to our protocols?
I think the most important thing after and over and above all those measures is to put our trust in Almighty Allah and to ask Him for protection. So, the teaching in Islam is tie your camel and put your trust in Allah. Clearly, you've mentioned all the measures, and I think those are quite comprehensive. I think they would offer enough protection to anyone who is subjected to those measures from this virus. So, I think it's quite comprehensive and it covers everything.
Alhamdulillah. This is an important question that was asked. I mean, schools give much more to our children than merely opportunities to learn. And if schools don't reopen, and if parents opt to keep the children at home, how does it affect a child's social, emotional and mental health?
Absolutely. I think it's so important for the take-home message, if you forgot about everything we mentioned in this discussion, to know how important it is for children to learn. Their primary objective in the formative years of their life is learning and to educate themselves so that they may become a prosperous people one day. And that learning, as we all know, starts from a very, very young age. It starts, from the time they are at home, we start teaching them. But obviously, as they grow a little older, they need a more formal, structured approach to their education and their learning. But we cannot underemphasize the importance of learning. And even as Muslims, we are taught the value of education and how important it is. And irrespective of what the circumstances are, I mean, in Islam we are taught that we should seek education and seek knowledge, even if it means going up to China, which in those times, and in the times of our Prophet Muhammad sallallahu alaihi wasallam, that was an extremely distant land. I mean, if you look at the modes of transport and all the other factors that would have involved going that far. But so education is extremely important. That is the fundamental or the foundation from which we grow our children. That's the first thing. The second thing is that social interaction that the children get at school, the structured approach that they get, the learning, the teaching from their teacher, the instruction from the teacher is so important. They often use their teachers as their role models, and they're rightfully supposed to do that. So that is so important. The structured routine is so important. They play time with their friends, sitting down and eating with their friends, having discussions with the teacher, having discussions about whatever is going on, whatever they need to discuss. It's so important for them to open up their minds, to look at the world with the eyes that they're supposed to be looking at it with. That emotional build-up that they get from school, the physical strength that they get by going to school, the routine, the discipline is so important. I mean, I can go on and on talking about it, but I just want the parents to know that it is so important, it is so beneficial that we send our kids to school, and we must thank and make dua for the educators that also make sacrifices and also put their lives at risk by going out to teach these children. So I think it's very important that we remember that these educators are also sacrificing a lot. They're also going out of their way. They're also putting themselves and their families at risk in some way. But with the same token, it's very important to know that educating our children is extremely important, and there simply is no substitute for going to school.
Alhamdulillah. Dr. Omar, Jazakallah for taking the time off. I know you're going to bill us for coming to your office, but do you have any parting advice for our listeners with regards to whether, those that are on the fence, whether they should send their children to school, don't send their children to school? Any parting advice?
Okay, just for clarity purposes, this is done pro Dio, which means for the pleasure of God Almighty. There is no bill. Yeah, with regards to the parting advice, there's a few aspects I think that's very important. The most important thing is we must always put our trust in Almighty Allah, irrespective of whatever situation we are in. We must know that everything is from Allah, and it's important that we put our trust in Him and we take all the necessary measures. But we cannot bring our life to a complete standstill. Obviously, there's a new way of doing things. We call it the new normal way of doing things. I mean, you're wearing a mask, I'm wearing scrubs, we're sitting over here. It's just a new way of doing things. But life has to go on. You know, we still have to do what we have to do as humans. And I think we just need to know how to adapt in a way that is safe for everyone. What's important to know is that this virus is not something that's going to disappear in the next few weeks or next few months. It will probably be around with us for many years to come. So the question we're going to ask ourselves then is, for how long are we actually going to hold back and keep our children at home? And the answer is we can't do that for long, because it is mentally damaging to them, it is psychologically harmful to them. So we have to move on. We have to allow our children to progress. That's one important point. The other thing that's important to know is children are not super spreaders of the virus. And also this, like we mentioned earlier, it's primarily a disease that has spared children. So we can have that level of confidence, and there's a lot of studies to now back that up, you know, which we can go into and look at. But alhamdulillah, children are relatively safe from this virus. So we can send our children back to school with a great degree of confidence, knowing that inshallah they will be safe from the harms of this pandemic. I think it's also very important to know that it's not healthy at all to keep them back at home. And then the next question we have to ask ourselves is, how long are we going to keep them back at home? And we can't keep them back for 2 years or 3 years, because that's going to be extremely damaging to them. So I think that's one very important thing to know. And the second part, a lot of children will be returning to school after the recent summer holidays, having lost either one parent or both parents. Many people from Al-Falaah College, many kids will be returning back to school. I think it's very important as Muslims that we look for these children, we look after them, we show them love, we show them compassion, we show them that we understand, you know, what they've been through. It is our duty as Muslims to look after these children and to show them all the love and compassion that they deserve to be shown, and the support. We should encourage our children as well. There will be kids in their classrooms that would have lost their parents. I think it's very important to be very sensitive to these children, and I would encourage people to, you know, just avoid conspiracy theories and rumor mongering, because it might affect the emotions of these children, especially those that have had to endure the loss of their parents or grandparents or any other close relative. And with that, I think we should end off on a light note. I was reading a joke yesterday where they said the virus is coming in waves, and that's why the government has closed our beaches down. So just be prepared for the next wave.
Jazakallah so much for your time.
Ameen, Allah reward you as well.
We will definitely hope that we don't have to trouble you again in the third wave and the fourth wave. But inshallah, the advice that you have given us, we will take it back and we'll take it to our parents, and inshallah those that are on the fence will make a decision whether or not to send their children back to school. Shukran, jazakallah khair. Assalamu alaikum wa rahmatullahi.